Hey guys, so I'm back again, and today I'm going to talk to you about something that really had me conflicted when I was beginning my midwifery training. This was whether to do direct entry midwifery or do nursing first and then add on midwifery post-grad. What I'll do first is I kind of explain what each is. So traditionally, to be a midwife you had to do nursing first, and it was about 3 years, and then you could add on your midwifery. But in the last 30 or 40 years, don't quote me exactly on the dates, they introduced direct entry midwifery, which in Australia means you just do 3 years of midwifery and then you're qualified as a midwife. You can work postnatally, antenatally, in the birth unit, and also sometimes in the nursery depending on the hospital. For me, I had a lot of trouble deciding what to do first, is because I knew it would be a smart idea to take the most qualifications as possible, but I didn't really think I could see myself working in all aspects of nursing, such as aged care. This is just because I felt like I had a calling to midwifery and couldn't imagine suffering for 3 years before I could do what I actually wanted to do. I'm going to kind of weigh up some pros and cons of doing either direct entry or nursing then midwifery, and I'm not really like of a strong view either way. I think I have a rather objective perspective. So for me, the pros of doing direct entry midwifery was that you're just focusing on women and babies. There's no men, except for partners of course, and so it's a very kind of like just feminine place to work, and it's very like nurturing and feels very natural. Now, another great part is that you're mainly dealing with healthy women. Of course, there is sick babies and sick women sometimes, but you're mainly dealing with normal healthy cases, especially as a midwife, because once it gets complex, it normally goes to the doctors. With nursing, people are sick. You go to the hospital because you're sick generally. Quite a positive work environment. Entry midwifery is very specialized, and this gives you a good advantage just to get a large amount of knowledge. So in the 3 years you're just focusing on pregnancy, birth, and women and babies, and yes, in uni you do study like pathophysiology and other aspects, but this is your main focus. So after your first year of study you can work as an assistant midwife, which is very similar to assistant nurse, but I know when I'm working with the nurses on the maternity ward, the midwives favour obviously assistant midwife just because we can help with breastfeeding. We're specialised to deal with babies, and so this makes me, I feel, more confident in my practice and allows me to do more. Doing it the 3 years instead of doing nursing and then midwifery means the training is more spread out and a little bit more easy to cope with. In Australia, especially New South Wales, I'm not sure about the other states, you have a portfolio which includes like you have to do 100 antenatal checks, 100 postnatal checks, 40 births. You have all these requirements, and if you do nursing you still have to do these requirements but within the 18 months. So one of the best parts about midwifery, about studying midwifery, is taking those follow-throughs. Essentially what a follow-through is that you recruit a woman, go to her antenatal appointments, then you're on call for her birth, and then you see her postnatally. So as you can see, right now we have to do 10 women in the 3 years, which is very manageable, but if it was all crammed into 1 year, I reckon I would struggle. Some of the cons about doing direct entry midwifery is that if you kind of feel like a sea change, feel like a bit of a career change, you can't branch out into say emergency, oncology. You have to stick strictly to your area. And I think for me, who always likes something new and always likes to educate myself on different things, it's a little bit disappointing that I can't move from maternity. Another thing is it's hard to travel to different countries with your degree. So I can't even work in England, which you think would be pretty close, because England's direct midwifery is 4 years and they prefer you to have nursing first. I spent a year in Sweden as an exchange student, and I would have loved to go back to Sweden and work as a midwife, but you need your nursing first. So that can be quite a challenge. Another different one that I wasn't aware of until I started training was there can be a little bit of a judgment that there's the fact that you're doing direct entry midwifery. Some of the people who do nursing midwifery will be like, you should have had your nursing, why didn't you do your nursing first? Because it's a new thing and it's a change, there can be a little bit of conflict there, but things are definitely changing and people are getting more accepting because they see that we have such specialized knowledge. In terms of my decision to do direct entry, I'm really happy with the decision I made, but I also think I'm going to do postgraduate nursing, which is a bit of a shock. But I'm very happy I started with midwifery because it was my calling, and it has been great, especially being so young and just working with young healthy women and babies. It's been incredible, but I also desire to branch out and probably work overseas. Definitely one downfall though is that nurses get paid to study midwifery, whereas when you do the 3 years of midwifery you don't get paid. So that's definitely something to consider. You don't get paid to do your 3 years of nursing either, but for some people that might be a contributing factor. So if you're having trouble deciding, I would say if you have that sort of calling to midwifery and you must be a midwife and you're passionate about that, I'd go with the direct entry. If that's all you want to do, you do that. But if you're a little bit unsure and you're like, maybe I'll do midwifery or nursing, I'd say why not give nursing a go first, because it's great to have as many options as you can, especially when you're young. So if you guys have any questions about this, leave it below and I will get back to you. If you have any requests for more videos or more information that you want, just let me know and I'll make it. I'm going to try and get a new video out every week, so there will be quite a fast turnover there. Thanks for watching again, and I will see you next time.